Can you see my screen? Okay, perfect. Welcome everyone, and thank you so much for joining us today on our webinar for the prevention strategies for youth during COVID-19. My name is China Locklear, and I'm one of the Public Health Project Associates at the National Indian Health Board, and I'll be moderating today's session along with my coworker, Munez. So we'll go ahead and get started. And just as a disclaimer, this webinar is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services as a part of a financial assistance award totaling $2 million with 100% funded by the CDC and HHS. And the contents are of those of the authors, and they do not necessarily represent the official views of or are not endorsed by the CDC, HHS, or the U.S. government. Just a little bit of background on the National Indian Health Board. NIHB is a 501c3 charitable organization created by the tribes over 40 years ago to advocate for the health of our people. And NIHB does serve all federally recognized tribes and advocates for all health issues that are related to public health and just policy in Native in Indian country, excuse me. Just a little bit about the webinar and some protocols. This webinar is being recorded at the moment. You will be able to access it in a few days on our COVID resource page. So please look forward to that, and you can use that as a future reference. Throughout the webinar, please do keep your lines muted. You are able to access the chat box at any time for questions or comments. We do have two chat boxes. One is a chat box, and then one is a Q&A. So, just put your questions in one and the comments in another. And then we are also doing a post-webinar evaluation. It will be sent out within a day or two after this webinar is over. And please do fill that out because it really helps us figure out, how we can best serve you guys. So that would be awesome. And we will go ahead and start with our presenters. So I would love to introduce our three presenters today. The first one being Josh Cocker. He is from the Native Wellness Institute, and he will be speaking today on healing and how to get through these times that we're going through with COVID. And we'll go ahead to our next speaker, Roger Peterson from the Northwest Portland Area Indian Health Board. Roger is a text message specialist, and he'll be going through some of the text campaigns that they've been implementing and some of the web designs that they've been implementing as well to promote safety with COVID and preventing strategies. And then lastly, Thomas Lee Gostock, also with the Northwest Portland Area Indian Health Board. He is the project coordinator for We Are Native, and he's going to be telling us all the awesome things that they're implementing and the programs that they're doing at We Are Native and everything like that. So I will go ahead and hand that over to Josh, and I'm going to stop sharing my screen. Okay, Josh, you can take the floor.
Thank you, Mauride. It is a beautiful day. Don't know what the weather is like where you guys are at right now. I'm just outside of Santa Barbara in my wife's village. She's Chumash, so we can't see the ocean. We're on the other side of the mountains, but it's nice. Yeah, I was super stoked to be able to come on today, to be able to talk about some of the efforts that the Indigenous 20-somethings Project and the Native Wellness Institute has been implementing since the beginning of the pandemic. I mean, when it hit, everyone was surprised, and we weren't really sure what was going to go on and how to do this. All of our trainings prior were all in person, and we decided just jump into online. So one of the things that we started doing was doing a daily power hour. The Native Wellness Institute on their Facebook page, 12 o'clock to 1 p.m. Pacific Standard Time. We have a power hour where a speaker will get on and talk about a specific topic to empower and uplift everyone who chooses to join us. And the Indigenous 20-somethings Project, when we started jumping on, we wanted it to be tailored to younger generations. We wanted it to be uplifting to some of the guys who can't go to school anymore, whether that's like high school or college. So we were doing all kinds of silly stuff like fort building challenges to like obstacle course challenges, just building stuff in your or building an obstacle course in your house with the things around in your kitchen and whatnot. And it was a lot of good fun, but we found that there was a little bit more needed in order to be able to support, our young people during this time. And so we started to reach out to the organizations who are taking care of them in their various communities. Since the beginning of the pandemic, we've worked with groups in Michigan, Washington State, Oregon, New Mexico, and the and all over Alaska as well, with groups who are focused on working with youth, trying to help them find ways to connect with youth during this time on this virtual platform, and how best to be able to help them move forward too. One of the things that we have found is our original playbook, I guess we could call it, uh, still carries through um, on this media platform. So one of the things that, or a few of the things that the Indigenous 20 Somethings Project really focused on was education of healing through games, through storytelling, and through choice. So like the traditional means of educating. And so we do that now, like right now we're here in this virtual space, but actually you guys are in my room and you're here seeing my guitars sitting on my couch, and you're in your house. So this bringing each other into our personal space, into our home, is a really significant gesture, which before was kind of not the norm. But now that we're engaging each other in these spaces, we found that since it is more personal, we invite that. We encourage it to be more personal. So we will often play games of like you could ask someone to go and get an item that helps them live in balance during this time. Ask them to get an item in their house that inspires connection in this time. People come back with really interesting things. Sometimes it's like sacred texts from different religions. Sometimes it's a PlayStation controller because they connect through online gaming with their friends that they can't see right now. But it opens them up to us and us to them. And in that notion, as we become more alive to one another, it becomes incredibly easy to connect with them in areas that they need the support. And most of our young people are looking for that kind of support anyways, just don't really know where to go for it. I want to make sure that I'm keeping on time just to check China. 12:20 is when I'll stop for questions. Sorry to do this. Okay, cool. Thank you. And through these support groups that we've been doing and online trainings with other organizations who work with youth, we've also been doing a lot of or trying to diversify like what a support group means, or just expand the definition of that. One thing that we've been doing with youth in Portland for the last little while is we've actually been cooking with them. So the youth will decide what meal it is that they want to make. We will deliver the food as an organization to these families in Portland, and the youth will cook for the family. And so we all get together. We're all cooking the same thing in our different kitchens, laughing around and joking. And during this time too, there's a lot of families out there in our Indigenous communities, and a lot of families who are not in our Indigenous communities who are needing the help right now to put food on the table. So we were just trying to figure out what are the ways that we can support them. And that can be a little bit of a different question than what are the ways in which they need support, because in the ways that they need support, you really need the individual to open up to you. But we all know that food is helpful and everybody likes to eat. So getting them that food has been a really big priority. Being able to be together, so trying to use traditional skills while we're together as well. Painting. We actually so I in the introduction there was a slide and it said that I went to school back home in New Zealand and I studied outdoor adventure and facilitation. And while I was there, I became an outdoor instructor, and I instructed in rock climbing, whitewater kayaking, sea kayaking. Later went on to work in search and rescue in New Zealand, Australia, and then here in the US, before I worked at the Native Wellness Institute. And I was telling some youth about some of I guess the adventures I'd been on. Sounds kind of cheesy when I say that, and they were like, "Oh, that's really cool. We kind of want to know some of these skills." I had told them that I had learned how to make deadfall traps, and so we got a painting canvas, and we took the canvas off of the wooden frame, and the wooden frame of our canvas became our trap, and then the canvas itself we sewed into a sling. And so we were able to teach principles of trapping and using a sling, like culturally based teachings with these youth through repurposing like this this kind of common object. So that's something that we've been doing as well. I guess I should have started with this. The goal of the Indigenous 20-somethings project and the Native Wellness Institute is to end the negative effects of historical and intergenerational trauma. And so with that in mind, all of our power hours, all of our trainings, and all of our support circles have really been measured against that goal and purpose. And we have found that when we're working together for the common purpose of like ending those things, whatever they may be in our communities, because there's 600 different federally recognized tribes, a lot of different ways that can be interpreted. Whatever that means for us in our communities, as long as we have that as our main focus, the what becomes very, very easy. What to do becomes easy. How to do it becomes very easy, because the why we're doing it is so short, if that makes sense. I just wanted to share a quick experience, a story that we had with a group in Kokomo, a youth support circle that we were running. It was the trap building one. So I was telling them like how to do a timber hitch knot, and instructing them how to cut the wood in order to be able to break it. And we ended up setting up the trap, and we were able to talk about the idea of trapping. And just by like opening up to each other through like physically moving together, it allowed space for us to be able to talk about some pretty important things. So as an example, when we had set up the trap, I explained the best place to set up a trap when you're on the move, like traditionally our people, or in the plains at least, we're moving encampments, were to be near water sources. You could go to a place that is frequented, definitely water. Walk around the edge of the water, and you could find tracks of the animal that you want to eat. And as soon as you identify that relative, you find a well-traveled path and you set up your trap. But your trap, as a piece of rope, a stick, and a rock, it's not finished yet. It's ready to go, but it's not deadly. What makes it deadly is the bait. Once that bait line is live, and you've put like peanut butter on there or whatever is going to draw that animal in, that's when it becomes dangerous to the animal. We talked about how simple of a design it is. You have one stick, one string, and one rock, but that trap could end a life. And we were talking about how there are people in our communities, who will do the same thing to us and to do the same thing to other people that we love. And it's not to inspire fear or anything, but just to start wrapping our minds around the idea of not everybody is wanting all of our success at this time. There's a lot of emotion going on. We need to be aware of that. It could be someone just always putting negative comments under your photos on Instagram, or or leaving all of your messages on seen and never replying to you. And I was explaining to these youth that we have to be aware of these things. If we allow our mind to go to these places, and understand this, then we'll be able to recognize it when it shows up in our community. We'll be able to help those who are in need of help too, right? Because hurt people. So we don't want that kind of stuff going on. And all of the youth were like, oh, okay, that makes sense. And so we went another step after like talking about that for a little bit as a group and exploring that idea. And then I asked them, these traps are incredibly simple. And if you look at your life in retrospect, in times where you felt trapped or you felt triggered or you felt down in the dumps, like, how did you get there? Right? The process to get there was pretty straightforward when we're looking back. But in the moment, right, it's so much, it's happening so fast, it's crazy. And you just kind of end up there and then you feel terrible. I was telling them that certain baits will draw in certain animals in the same way that there are certain things that will draw us in. When we can identify those things that bait us into terrible situations or terrible feelings, then we'll be better apt to be able to avoid those traps in our lives. And we as a people will grow stronger because of the individual. That conversation took off in a direction that I had no idea that it would. The youth started opening up about things that they're struggling with during the time of the pandemic. One of them was saying, I love my family. I have always loved my family. I just want to see other people, and I think we can all like relate to that, but it just gave space for them to feel safe and brave enough to come forward with the things that they need help with. Really, the Native Wellness Institute, since going online, has empowered the Indigenous 20-somethings Project to work with youth a lot. And we've just been doing the same thing. So if there's anything I could offer in terms of helping youth during this time in giving yourself a platform or preparing a platform to speak from, to encourage them to be safe, it would be to play as much as you can with them, joke around with them, and be there as much as a friend. When we're on this online platform, sometimes you have to project yourself a little bit more than you would if you were in person, because when you're talking to people and your face is blank or you're leaning back, these youth, they see that and they can feel the energy through the computer. So you have to be a little bit more, but if we as coordinators, if we as contractors, if we as like professionals in Indian country are going out to help these young people, are willing to take that extra step, only good things will happen. So I just wanted to give that little update on what we're doing, and share that little story, and got a bit of time to take some questions. So
there is one question for you, Josh. How have you used the Power Hour to share information about preventing COVID infections?
Ooh, that's a good question. Yeah, so during like the pandemic, we've been giving regular updates. Every time we start a Power Hour, if there's any significant piece of information that's come out by like medical professionals or any journals that like the person presenting has read, then that will be shared. Another thing that we do is we try to continuously keep up with the CDC's guidelines of safe practices, and we encourage those things when we're on the Power Hour. So we, in our support circles, in our other trainings, and also in our Power Hours leading up to Thanksgiving, asking people to be safe. During this time leading up to Christmas, we'll be doing the same. Stay as safe as possible. Stay within your own home and family. Let's try to slow the spread of COVID, but also talking about some of the reasons as to why some of our communities have been hit so hard, kind of exploring the social and economical disparities that have led to those outbreaks being so severe. And then again, encouraging our people to follow like modern best practices as they evolve, right? Because at the beginning of the pandemic, their medical professionals say, I don't need a mask. And then later on they said, oh, we do need a mask. And just kind of allowing people to take that in as they can. And we try to elevate what we believe is the best stuff out there. So I hope that answers your question.
Thank you. Yes, there is another question for you. Do you have any other suggestions of how organization can draw in the youth for virtual session to help them connect specifically when they want to hang out in person?
Yeah, that one can be a tough one for sure. I think meeting the youth where they're at is the best way to do it. So it can be, we really have to make sure that we're willing to grow with the idea of what it means to hang out online with youth as adults, you know. Does the organization have the ability to like share a movie on screen or send out popcorn so that you guys can eat popcorn, watch a movie together, talk about it? I know when we meet with youth, sometimes we want to have these serious discussions and be able to kind of figure everything out in one sitting, but really it just comes down to being there with them. We've done things like even playing a game called Among Us with them on our phones and chatting in the chat in game while also being on Zoom. Just doing things to make them feel comfortable will invite them into the spaces that are safe, like being online rather than hanging out with each other in person. But I think in that case too, it might be helpful if the community at large is quite comfortable with letting like their young ones move around a lot. It might be worth looking into some sort of adult support circle too, and beginning to encourage safe practices within the home to help the young people also have that backup. So it's like, it's not just some talking head on the computer. It's, oh, my mom telling me I gotta be safe too, you know? So unifying the message.
Thank you.
Do we have any other questions for Josh?
There is no more question for him.
Okay, well, thank you so much for joining us today, Josh. We really appreciate it. You gave a wonderful speech. It was very informative. I really appreciate everything.
No problem. Thank you guys for having me.
Thank you. And we'll go ahead and turn it over to our next speakers.
Cool. Thank you, Josh. I always enjoy listening to you talk, especially with the 20-something project and the Native Wellness Institute. So appreciate that. Roger, would you like to pull up our awesome, amazing PowerPoint? Cool. So I would just like to say hello, everyone. Good afternoon, whether you're on the East Coast or the West Coast. My name is Thomas Lee Gostog Jr. I'm an enrolled member of the Burns Paiute tribe, but I'm also Oglala Lakota on my dad's side. And I am the We Are Native project coordinator at the Health Board. And I will pass it to my coworker and co-presenter, Roger, to let him introduce himself, and then we will get started.
Hi there, everybody. Thank you for being here today. My name is Roger Peterson. I'm from the Slouch Tribe of Oregon. My pronouns are he, him, his. And I am the text messaging specialist here at the Northwest Portland Area Indian Health Board. And I get the question a lot, what do I do all day? Do I just send text messages? More or less. But really, I work out to code the back end of our various interactive health-based text messaging services. So I'll get into that a little bit later, but without further ado, let's get this going, Tommy.
Cool, thank you. So we heard some great information from Josh about, engagement with the youth. And we thought we'd share part of what we do with engagement of youth, both virtually, but also really the messaging that we try to put out as it's related to COVID, and give you some insights on how the We Are Native team kind of navigates this new era of COVID-19, both with the messages and really trying to, make these messages youth-friendly and engaging. So some learning objectives that we've put together for today. I'll give you a second. I'm not too big on reading over slides, so I'll let you glance over that. And China does have the PowerPoint, which will be available to share after. So if you want to look at those learning objectives again, but we're going to go through them. So next slide. Before we do that, we just want to give a quick shout out to the Northwest Portland Area Indian Health Board, where We Are Native is housed in our Tribal Epidemiology Center. We service the 43 tribes in Oregon, Idaho, and Washington. Shout out to Burns. If you look right below the Oregon, that's Burns. So I always have to give a little shout out. That's where I'm from and grew up. So shout out to the health board too. Next slide. So really quick, if you haven't heard of us, I highly suggest just Googling We Are Native. As a precaution though, we are going through a transition. We're changing web developers, so it might be a little wonky, but we're getting that fixed. There's so much info on the website that I could talk about it literally all day. But I just want to really encourage you to visit our website. We have health topics ranging around sexual health, mental health, all the way to community involvement. So I really, really highly suggest that you just kind of cruise through it. We created clickbait on purpose so you can kind of stay on our website and cruise it. So next slide. Again, here, I'll give you a minute to kind of read over this slide as it has quite a bit of text, but I just really want to point out that we have over 400 wellness pages, health and wellness pages. So we get questions, what does that actually mean? So back in the day when We Are Native was being born, we sent out these health articles. So we sent them to youth, Native youth, young adults. We partnered with local college, tribal colleges here in the Northwest, and we sent out these articles and we said, can you review them and make sure they make sense? We also sent them to health educators, much like everyone on this website, and we said, can you review this and make sure that the population that you serve can read this? So they made those edits, and then that's what you see on our website. So we wanted to make information very easy to get to, but also make it understandable. Next slide. Quick shameless plug, get at us on We Are Native on our socials. All of the messaging that you're going to see through these next slides are going to be on our social media, our Facebook, our Instagram, our Twitter, our YouTube. So if you want to see it, for yourself or scroll through it, feel free to follow us. Yeah, next slide. Okay, so we're getting into the nitty gritty of the reason why we're all here today at this awesome webinar. Shout out to NIHB for putting it on and hosting such a great event, especially when it's needed during this time. We get asked a lot, what content should we focus on, especially with We Are Native. We're not, specific on one content per se. If you look at our social media, we post everything from a gift wrap condom, which we posted yesterday for sexual health, all the way to mental health and how to reach out for help and find resources. So, I think a lot of the times on what content we should post for COVID, there's a few things that we like to focus on. And we're fortunate enough to be housed, like I said, at the health board, where we have a COVID messaging team that kind of reviews our content to make sure, we're putting out there the most correct, medically accurate information. So when you're thinking about putting out content and reaching youth and how to, kind of let them understand what's going on, first we look at what's trending. We have a lot of articles that get passed through emails. So what we do is we like to take the trending topics, on what's going on, whether that's a new, mandate that is put out by the CDC, whether that's, new mask measures, anything that's trending, we like to make sure that we're on top of it because that's the content that's going to be the most relative and most popular, right? But we also share what's working for our audience and our community. We want to definitely make sure we're posting, relevant content that they're going to understand and that they're going to want to see. So that's what we'll get into a little later in this presentation on how we exactly do that. But for the sake of this webinar, some content that we've helped other tribal organizations and other tribal communities is really community specific. And I think each community is different in a sense that, each state has their own mandates. Each state seems to be different within the information that they put out, So we try to help tribal communities, whether they're pushing just to wear face masks, whether they're, pushing social distance, but also really helping them with their, like I mentioned, with their own state mandates, because each state is different. So we really try to help in that sense. So all of these are great ideas to start with when you're thinking about what content, you should be putting out, what content you're trying to use to reach your audience, whether that's health educators or youth and young adults. So next slide. With that being said, much like Josh mentioned when he was talking, a lot of our events got pushed to virtual. We had a lot of events planned on our schedule, and I was super excited. I was going to get some flyer miles in there to get out to and reach reach youth in their own communities. But, obviously COVID happened and all of our travel came to a screeching halt. So as a We Are Native team, we had to go back to the drawing boards and we had to say, how can we create this virtually? How can we virtually engage youth in a safe place and make it interactive? So we did 4 events throughout this past summer and into the fall. We did a boot camp, which was a boot camp held with the Siletz tribal youth on domestic violence and the consent video. Again, all of our videos are on our socials. So that was one of the events. We did another virtual event with our youth ambassador program. And then we did a virtual Thrive conference. So if you're not familiar, every summer, the end of June, we have a Thrive conference, but that was again canceled. And so what we did is we turned that to virtual. And then our last event, which is our most recent content that you've probably been seeing, is our springboard. Indigilove begins with I. So all these events, we saw some common themes pop up, and I think these themes are really what drives our scheduling, drives our content. But really, it was the youth and the young adults wanted a space to talk. And what I mean by this is, I think as health educators, we get so busy and caught up with trying to keep the youth and the young adults busy, with a full hour of Zoomed events planned, like, a tight schedule, a tight agenda. And they are great. We had awesome events planned. We tried to keep them engaged the whole time, but we learned really quickly that they just wanted a space to talk. And so once we realized that, we kind of dropped some of our agenda items and we just asked them how they're doing. And we got a full 30-minute to 45-minute, conversation on them just talking. And we had to do very little. That was just them talking, how they're feeling, how they're going through this COVID situation, how their friends are. And so we just ended up, listening. And that was the common theme, is that, they just wanted someone to listen to them. So I highly urge you as a health educator, it's great to plan events. It's great to hold these virtual events. But also, if you can, squeeze in a good 20 minutes just to have the youth talk to each other and talk and say how they feel. Because I know a lot of the times, again, with those agendas, we leave 5 minutes or 10 minutes, for discussion. And by that time, you're trying to squeeze in your last 5 slides or the, 5 events that you're trying to doing, and then the event just ends. So I really, really highly suggest that, just have them talk to each other. And a big one that I think that they expressed the most was that they wanted older adults to stop downplaying their emotions. And what I mean by that is, a lot of them expressed that, hey, you're young, you have your whole life ahead of you. COVID's going to end, and, this and this and this. But the more I heard them talk and the more I heard them express themselves, they're right. And I'm not ashamed to say I kind of downplayed on some emotions too, but after talking with them and thinking about my own situation, a lot of them, a handful of them actually were graduating and going into college, right? And that college transition is a big chapter in your life. And a lot of them didn't have that experience. They didn't get lost in their dorm. They didn't get lost on campus. You know, they didn't get an opportunity to find their, you know, favorite $5 meal. And all these colleges experiences, they said that they're missing out on that. And I look back at my own experiences and I'm like, man, that would be super tough. So, you know, I think when we downplay their emotions, that gets them more, you know, that gets them more frustrated. They are young people, they are young adults, but they have real emotions, they have real life, you know, challenges. So again, as educators, we just need to realize that and not downplay them. But also, that being said, I think they also wanted to learn and they were willing to teach. They expressed that they wanted to teach their grandma, they wanted to teach their elders how to Zoom, how to FaceTime, because, you know, during these times they wanted to keep them safe, but they also wanted to see them. So a lot of them expressed, you know, kind of balling out for Christmas and getting a tablet for their older relatives so they can teach them to you know, Skype, to teach them to FaceTime again. So they were willing to teach. So all you health educators out there, I just urge you and challenge you to listen to them. I know it can get really frustrating. I know technology can be super tough, but during these times, it's worth it. And, you know, it's worth it to learn it. So again, be willing to learn and be willing to teach. Next slide.
Great. So thanks, Tommy. So with all those common themes in mind, what do we do with all that? So we have to make it relatable. So the why question that always comes up is, you know, when you're dealing with youth, like, why should I wear a mask? And a lot of times, you know, fatigue sets in very quickly when you continually say, just wear a mask, just social distance, you know, just do all these things and you'll be fine. Well, why? You know, like, you know, youth sometimes see it as it won't affect me, or, you know, I'll be okay, or, you know, don't patronize me. Exactly. You know, so how do you make it actually relatable? And instead of saying, you know, hey, wear a mask, why don't you necessarily, you know, flip that narrative and say, what about protecting your elders? Or what about messages of empowerment? You know, when people are not feeling a certain way, they're feeling, you know, down and out, they're feeling disconnected. Messages of hope, resilience, and culture can really honestly pull people back up. And I think having that kind of hope for the future, seeing the light at the end of the tunnel, when you hear these messages of wear your mask, it'll be second nature. Like, you want to protect your aunties and uncles. You want to protect your grandma. You want to make it out of the pandemic. So in terms of making it relatable, hold on, I've got all these menus up on my screen. In terms of making it relatable too, it's got to be lighthearted to a degree as well. Not in the sense of, you know, at all joking or anything like that, especially with all the people that have been lost. And I'll show some examples too, because I know that's kind of hard to even understand. How do you make something so serious lighthearted to a degree? But in terms of messages of resilience, here's one right here that came out of one of our virtual, springboard conference, and it's just a poem that was written by a youth, just about his, you know, about his life. And it was really powerful. It got, I think, almost 600 likes or something. And these are the kind of messages people want. So it's not, you know, when we post something on Instagram, it's an automatic feedback loop for us. You know, we're getting a lot of likes. We know exactly what the people want. And overwhelmingly, it's been messages of hope, resilience, and culture. So I will go to the next slide. So here's an example of some of our early COVID messaging, just kind of seeing like what worked. And, you know, we found that kind of these kind of here in the bottom right corner, this "Hey Victor, heard about that COVID-19." It makes it more relatable. You know, it's kind of like a hearkening to a movie. We kind of moved on and did kind of like a native version of Mr. Clean with some tats and the braids and the jewelry. It got a lot of likes as well too. So, you know, it's not that people are 100% burned out on COVID messaging. They're burned out in the traditional methods of COVID messaging. And I know Tommy mentioned that we have a COVID messaging group. And we do. We have a COVID messaging group at the board, which I'm a part of, but that's geared mainly towards adults. And I think it was Corey that mentioned, or a previous presenter, that you've got to also do some outreach to the parents. You know, so we've been doing that in tandem with our messaging on We Are Native to just really make sure that the parents are also armed with the information. You know, if we tell the youth, listen to your parents, listen to your elders, you know, we got to make sure that the elders and the parents are prepared themselves to give that information to the youth. So I just wanted to do a little plug there for, you know, the COVID messaging that we've been doing for the board, and kind of how it's been a little bit divergent for the messaging with our youth. So here's just a couple more examples of, you know, our Mr. Clean in different poses, Uncle Clean, I guess you would say. So with that, I will pass it to Tommy for the next slide, and put myself on mute.
Cool, thank you, Roger. And just really quick on the messaging there with Uncle Clean, like Roger mentioned, we want to be relatable, and it's crazy when you think about it, but unconsciously when people see that, they see Mr. Clean first, right? And they start to pay attention to detail. So if you check out his moccasins, he's got tats, he's got his little We Are Native shirt on, his little necklace. So the details are what people are going to look at first, right? But unconsciously, they're reading the content that we put into the caption. So if you're able to captivate, your audience with imagery first, and then they're going to read the caption, so again, we're like Roger scrolled back. This one was a play on words. So I don't know if you're familiar with, but there was a funny meme that went around that says, "Hey, you better don't." And it's kind of just, I don't know what you call it, like res slang, like joking res slang, like, "Hey, better don't," or, "I better did," or "I didn't do that," so just have those play on words. And so I think that's what kind of really captivated people at first, but we wanted to definitely put a safe message in there. So wiping down their mobile device too. But then if you look at the actual caption, we made a post about cleaning the spaces that you're at. And, I always listen to music when I clean. So, if that might help other people, then we added that. So again, I'm trying to squeeze and squint. Oh, so that one had 232 likes on just something about, cleaning. So we know people are seeing that, and subconsciously they're going to, realize and understand the messages. So that's the big thinking with the Uncle Clean. And then choosing your platform is super important as well. If we gave you the information on, maybe what content to post, how to, rearrange the content to make it, relatable to youth, but it's just as important to choose the right platform that you're going to reach your audience at. So this is a messaging that hasn't been released yet, so you guys get a sneak peek. But I thought about if Uncle Clean could Zoom his friends, what would they look like, right? So this messaging is going to be around the holidays and Zooming the friends that you might not be able to see because of the COVID restrictions and COVID travel restrictions. So we had some fun with this, and this is Mr. Clean's homies that he's Zooming because he can't see them for the holidays. So but the platform he chose is Zoom. So again, if you're messaging and you want to show a lot of pictures, I would suggest Instagram. If your audience is all on Facebook, if they have a Facebook page, if you have a tribal Facebook page, really make sure that you're strategic with what platform you use to get your messaging out, because you want it seen. And also be willing to listen to the youth, right? Remember I said with the common themes is learn and be willing to listen. So if they're on TikTok, you don't necessarily have to create a TikTok and be kind of intimidated by it. Reach out to a youth who is a TikTok master and does a lot of TikToks and ask them to help you, right? So be willing to learn and be willing to step out of your comfort zone to fully reach your audience with the messaging. Next slide.
And this one, I think this one's mine. Yeah.
Yep.
So what's really important too, in thinking about all these like messaging strategies, sometimes, all the content that's been thrown out there, it's hard to kind of like think of it collectively. But one thing that, I would like to impart is to, stay planted on the content and the successes that you've already had, and, pivot to just moving that in a new realm. So, if you've been successful with your posts in the past, just find a new way to tweak those for the new landscape. So I guess in that sense, I'd say pivot, but, stay planted on your content foot. And also, make sure that you also are reposting powerful content. Like if you're sitting here on an island trying to think of what youth want, like you're never going to do it, unless you're a native youth yourself. But in general, you've got to go look for powerful content that already exists. And maybe that just leads you down the path of creating your own content. But we do the same thing too. Just because it's burnout to create that content all the time when it's already being done by awesome organizations. So Illuminatives, OHSU, Native Youth Our Medicine, there's so many great resources out there. I'm not saying go ahead and like steal everybody's stuff, but get some inspiration from people who are actually doing awesome stuff. And then when you post really good content like that, you become a trusted voice. So as you continue to post high quality content that either you're sharing or you created yourself, people are going to look at you as someone who knows what they're saying, someone who knows what they're doing. And we've tried to do that with We Are Native, posting content as quickly as it's available with new information surrounding COVID, and also posting relevant sources too. So we're not just out here trying to post things that aren't relevant or useful to people. And then finally, just realize you can't do it all, just take it one step at a time. I think people look at all of the, the things that they think are required to do, useful or adequate messaging. And where it really begins is just with one step forward. So, reaching out to a contact, throwing something at the wall and seeing it works based on what you've heard and learned through, webinars like this. So I will go to the next slide then. And this here just kind of shows, or is this yours, Tommy?
Go for it. You're on a roll, big dog.
Okay. Well, this here just kind of shows a recent partnership that we did with OHSU. And are we going to show this at the end, Tommy?
Yeah, I think we have time because we only have a couple more.
Okay, great. Well, I'll keep rolling through it. So we did a bunch of these videos in tandem with OHSU, and they're really well done. It's not something I could have created. So, in terms of, like I said, tapping all your resources, they're really professional and they really hit well too. So the message of, if I practice sweats, am I keeping my community safe? Am I doing this and that, what I've been told for the past 6 months? So, having that message of cultural connectivity and not just literally saying, wear your mask, has been really important for us. And then also, I've said this before in the past, and I'll just mention it one more time. Viewer fatigue is real. And I think we can all feel the fact that we're all getting pretty sick of, people telling us to social distance. And we know that by now, but hearing it over and over and over again, it almost makes you not want to listen to it. So make sure you sprinkle in content too that's not COVID related, that's lighthearted, that's uplifting, because it's very possible and very real, to get viewer fatigue from this kind of thing. And I think there's 300 million Americans that are probably all feeling it right now. And in that regard, I just wanted to mention a couple of our different campaigns. So when I say, oh, mix up your messaging to keep it lighthearted, well, we do. And we have a number of different campaigns. We have one here that we just brought online it was about a month ago. And it's text caring to 65664. And it's just caring messages intended for youth. And they're great. I signed up for it myself, and I was having a tough day the other day, just, a lot of work. My dog was barking like crazy. And I got a message over the, the caring messages channel. And it said, like pain is like a wave, it rises and it goes back down. And I thought about it. It gave me a second to just think and pause. So, when thinking about direct messaging for COVID, sure. But what about this indirect messaging that can really just pull your mood up? We also have We Are Native that Tommy talked about, which is kind of our bread and butter, where we have, I think we have about 12,000 followers on Instagram and about 7,000 text message followers. STEM as well. Like Tommy said, people in the transition phase from, high school to college, maybe they're reeling and just looking for more information. So just having a lot of resources available, so super important. Fitness as well. I moved out of an apartment recently and I lost my little home gym thing that I had. And I need to get some running shoes and go for a run, honestly, but I guess I could text fitness to 9779. But really, just being holistic with your messaging and make sure that it's not just about COVID, that it's about wellness and cultural connectivity. And I think that's our last slide. So Tommy, do you have anything to add before we show these videos?
Lastly, I just want to add, I think it's a great time to step out of your comfort zone, and be willing to try something, because I can tell you firsthand that all of the content you saw in this presentation webinar, it was all done through trial and error. We'll post something that I think is fire, but it'll get like 1 like, and it's like, dang, okay, I gotta go back to the drawing board. We have to go back to the drawing board. So, I think the time is now, step out of that comfort zone, try something new, reach out to someone. But like Roger said in that last slide, is reach out to the youth that you're wanting to reach. Ask them what they feel. If you're a program and you have the funds available to do so, pay them a small stipend to help create content for you, or at least, review the content that you're looking. Because like I said, if you're scared or intimidated of TikTok, like myself, I'm not going to try to get a TikTok and, pretend I know what I'm doing. And, because youth and young adults, they'll catch you really quick, and they're quick to call you out on it as well. Again, learn through trial and error. So just take chances. I think as a time of COVID, everything's new. And I think a lot of organizations, including us, are experiencing new stuff. And so we're trying everything, that we wouldn't maybe have done in the office. And some of it's been working great. Some of it's been not so well. So we go back to the drawing board. So don't be scared to take chances. And yeah, that's all I have. We have 2 quick videos that we'd like to show. The first one is Roger put this together literally in like 20 minutes. So it's an example of messaging that you can do with your phone and a face mask and a voicemail, right? So, that's what I wanted to add. I wanted to add that. And I want to say, if you have the funds and your program can, get a cool looking mask, right? I think a lot of people forget that youth and young adults, we all were them, and we wanted to be stylish, right? We want to, have the hottest kicks back then. I don't even know if they say sneakers. So we wanted the hottest gear. So why not include that with the mask? So if you have the funding available within your program, get a cool mask. Reach out to us. We have a lot of vendors that we go through. We like to support native vendors. They have awesome masks. Just buy a bunch and hand them out. And if I guarantee, if the youth has a dope looking mask, they're gonna wear it. So that's my last bit of information. So go ahead and play that baby, Roger.
Hi, my name is Allison James. I'm Eastern Band of Cherokee, and I'm calling from Virginia Beach, Virginia. I wear my mask to protect my family, friends, and elders.
Hi, my name is Nadira. I am Navajo, and I'm calling from Tucson, Arizona. I wear my mask to protect my community.
Hi, my name is Joanne Ben. I am from the Navajo Nation. I'm calling from Phoenix, Arizona. I wear my mask to protect my friends, my family, and the elders in my community.
Hello, my name is Ayana Lynch, and I am an enrolled member of the Holowassa Pony Indian Tribe. I'm calling from Elon, North Carolina, and I wear my mask to protect everyone around me.
Awesome. And then Tommy, do you have the Safe Sweats video up?
I do. So we'll share this one, and then it's less than a minute. So after this, we'd be happy to answer any questions if there's any. So yeah, we hopefully enjoy this video really quick.
Sweats and ceremonies are important to me. My way of life, my family, my community.
However, if I go, I'm not protecting myself and people I love if I spread the coronavirus.
Our leaders and experts say the virus can be spread by someone even if they do not feel sick.
And if this virus spreads to people with health problems like diabetes or kidney disease,
it can really hurt them.
COVID-19 is a sad reminder of the ancestors that we have lost to diseases of the past.
Elders told me to adapt by practicing our ways and working up a sweat at home.
Exercising my beliefs at home is the best way to keep my family, community, and elders safe.
Now, I am being prayerful and protecting my people, the knowledge keepers, and our ways of life. Together,
we will
grow stronger.
Cool. Well, that's all we have. Thank you again. Yeah, so we'll pass it back to China, and if there's any questions, we'd be happy to answer them. But otherwise, thank you again for putting this on and allowing us to present today.
Yes, there are 5 questions. So I start from the first one. In thinking about addressing trending topics, what is a realistic timeline to post something that is accurate yet is still trendy?
Sure, yeah, I can definitely chime in on that. I've went through a number of CDC trainings over the past 3 or 4 months. And in terms of posting trending topics, if you're trying to be, like I mentioned in my presentation, a voice that people look to, you really honestly want to post that stuff as quick as you can. So obviously you need to toe the line of making sure that you don't post anything that's incorrect. Just because, if something is trending or something's happening, you may need to wait a second to verify that it's legitimate. But I would say, try to do it as quick as you can within your capacity. That's what I've been told, and that's what's worked for us too, especially trying to grow yourself as a trusted source.
And I just want to add, and because I forgot to mention it in our PowerPoint, is always check the source of the content you're either posting or sharing. I did mention we have the COVID team, but if you're sharing an article, the last thing, your organization page or anything you're posting is the last thing you want to do is post a non-credible source. All of our stuff is reviewed. It comes from organizations that we know and trust, like Roger said. So always remember that. You don't want to, start any rumors because they go like wildfire on the res. So.
Okay, there is another question. How do you justify talking events instead of scheduled events to funders?
So let me clarify on that. Is that, how do we justify, could you repeat the question?
Yeah, how do you justify talking events instead of scheduled events to funders?
Oh, so I guess virtual events versus in person, I imagine they're asking.
Yes.
Okay, yeah. I mean, I think, Tommy, do you want to get this one? Or?
Yeah, I mean, for us, I know the funding in our funders, we had these events planned, and for our funders, they were written into our grants as planned events. But I think with this COVID situation, a lot of this stuff was either canceled or didn't happen. And I know that in the funder's eyes, we knew we wanted to still make it happen. So we just said, we're going to do this virtual. We're going to use all of our resources as if it was in person. So the more communication you have with a funder to let them know what you're doing, the better. And really thinking about the whole aspect of what your event would be like in person, try to recreate every aspect of that virtually to the best of your abilities. And it does take a little more planning, but if you're willing to put in the work, that your event will be successful. So I would just say the biggest thing is communication with your funders and be completely transparent with them in what you're planning to do virtually, because in this day and age, I have a feeling they're going to be pretty understandable with the COVID-19 situation. So
I think any work that you do to informs further virtual events, if you do one and it was a success, you'll do two, you'll do three, you'll keep doing it. And I think for our organization, even when COVID's over, we definitely want to keep an element of, staying online and meeting youth where they're at, just because it's worked. So.
Thank you. There is another one. In general, to keep the audience engaged, how long should virtual sessions last?
In my opinion, they should be between 1 hour and 2 hours. Anything longer than that, it seems like fatigue seems to set in. And especially with 2 hour sessions, break in the middle, break at 45 minutes, especially with youth, it's really hard to hold them there for a long period of time. So I think the longest sessions we've done with youth are about 2 hours, Tommy, correct me if I'm wrong, but.
They were 2 hours with the break. Definitely have breaks.
And how do you keep the youth engaged each week, bi-weekly, monthly, even with planned events and incentives? Thank you. And they said, thank you. Yeah.
For us, I think it depends on your comfortability level. For myself, I have a text group with the ambassadors. So I text them just to see how they're doing. So it really depends on your comfortableness with them and meeting with them. But I also, on this question, you have to realize that we're health educators and our jobs got moved working remotely, but they're still youth and young adults. So they still have their lives going to online school, if they are still able to do sports. So for our whole staff, we had to rearrange our hours. So we did events on the weekends. I believe Roger has a speaking event tonight. So, our hours got completely switched, and luckily, and, we're fortunate enough to be able to adjust to that. So so I would definitely suggest finding a time that works for them, even if it might not work for you. You might have to get on at 6 at night. So that's what we've been able to do to keep them engaged at any level, whether it's a bi-weekly, weekly, or monthly.
It's already 4, but I'm gonna ask 2 more questions very quickly. So they asked, our youth really like the We Are Native logo. Where can I get the same mask as the girl in the video have? So they are asking that.
Hey, that was a prototype. So we're happy you like it. Send us an email. We will be getting more of those. And we're doing, kind of random raffles and giveaways. So send us an email and we can definitely make something happen.
Or just, follow us on Instagram and send us a DM over there too. So.
And they are asking, can we share the video with our organization? I mean, your videos with their organization.
Yeah, of course. I posted the Safe Sweats video. There's a lot more videos on our YouTube channel. So feel free to share those. Our mask video, like I mentioned, Roger just did that these past few days. So that'll be coming out soon on our social media. So, but yeah, otherwise they're all shareable. Check out our YouTube channel.
And one last question, can other tribes use the youth ambassadors?
Can you say that again? Sorry.
Can other tribes use the youth ambassadors?
Yeah, our ambassadors are equipped to do, some online virtual events. We haven't traveled them since the COVID just because of the safety. But if you get my email and contact from China, which she will be sending out the PowerPoint I saw in the chat, my email will be in there. So feel free to reach out and we could chat more about that question too.
Thank you so much. Appreciate that.
Is there any more questions, Una?
There is one more. They are asking any tips for generating effective ideas for message imagery.
I would definitely say that for anything that's like youth related, lighthearted and culturally connected. So, one of the things that we did recently was for Rock Your Mocks Week. We kind of did a play on sneakers and wear your Resi Boosts or whatever, kind of like Easy Boosts. So just kind of playing off things that are current and relevant, but also connected culturally and that have some sort of native flair. I mean, if it's for anybody, then why are you giving it to Native youth? If it's for everybody, So, Tommy, do you have?
Yeah, I would suggest really just pulling the meat and potatoes of whatever you're wanting to post. I guarantee almost all of us on here get emails from different listservs. And if there's a bunch of text, you kind of just scroll right past it. So what we've been doing is just pulling the key information that we want them to know and then using that. Because again, no one's going to like a big post with a lot of text on it. So pull what you want the youth to see because they're going to either look at it for 5 seconds or they're just going to scroll right past it. So that's what we usually do is pull the meat and potatoes.
The last thing I would say too is try to make your messaging actionable if you can. So, tell them to go take some time today to get some fresh air or something to do, because then it doesn't feel like you're just talking to them. It feels like you're talking with them, like you're having a conversation. So, anything that's actionable, even if it's just get fresh air or click a link or that kind of thing.
And then, I just love this question because there's so many, we do it all the time, but my last one, because I know we're out of time, but the last one is look at pop culture. Look at a lot of our imagery comes from smoke signals, comes from native movies that everyone kind of can resonate with rather than, different areas on different, just make sure it's general, I guess you could say. We use a lot of pop culture within native films. So like I said, a lot of our imagery is from smoke signals, Power Highway. So anything like that can definitely help spark ideas for imagery.
Well, I just wanted to thank you guys again so much for giving such an amazing presentation. I know I personally learned a lot that I can use myself for my own job, so I really appreciate it. I also did want to mention one more time that this webinar was recorded and it will be available to you on our COVID resource page probably in the next day or two. We need to get that uploaded, and I will also include the slides that Roger and Tommy went over today. And then we will also be sending out the webinar survey within the next day or two as well. If you could just please fill that out, that would be awesome. Thank you guys again so much. I hope everyone has a great day.
Thank you.
Thank you all.